This is Chick2Chick Uncut, raw and unfiltered.
If you are tuning into this podcast, first of all, thanks so much for doing that. Second of all, little advice here. Before you start really listening or watching, I suggest you remove all distractions. Everything around you, you really need to pay attention because we are going to tackle that medical monster of a program called Medicare. Yeah, it's one of those necessary evils that all of us are going to have to deal with at some point in our lives. It is confusing, it is complex, but we're going to try to boil this down in very basic terms so you have a greater understanding of what this program is all about. Now, you might be thinking, you know what, I'm 45, I'm 55. Why do I need to worry about Medicare? Well, maybe you have a parent who needs to sign up for the program and they need your help. So you'll have this great information. And I'm sorry to say it, but before you know it, you're going to turn 65. And if you have this information, it's going to help you make very informed decisions as well. Again, we're talking about Medicare for Dummies 101. Our guest today is Tiffany Sabrizia. She is a volunteer Medicare educator with AARP Pennsylvania. Tiffany, first of all, thank you so much for coming on this podcast. Tiffany, tell us a little bit about yourself, your background, and your knowledge of Medicare.
Sure. So thanks for having me. I really appreciate it. I think this will be a lot of fun. My background, I'm actually a registered nurse, and I've been doing home care for a long time. I'm specifically a wound and ostomy nurse. So I've seen a lot of patients with different insurance issues coming through what they can get, what they can't get. But I originally started volunteering with AARP because I wanted to see what I could also get more information of because my parents are at that age. So I wanted to be able to assist my parents with making some decisions down the road and just give them a little bit more information on it. So, I mean, I've learned a lot. It's, as you and I have talked about before, it's not that easy to understand.
It's very, very confusing, and I don't understand why they have to make it this confusing, but that's the reality that we're dealing with. So let's start off with this very simple question. What is Medicare?
So Medicare is a federal program, and you've actually been paying into it with your payroll taxes all along. So it's something then that we get when we're 65 years old, and as long as we've been working, we're eligible for it and we can apply for it. It's not a required thing, but it's definitely something people should do. And it just is going to give you different options for your health care as you're 65 and as you're getting older.
Okay.
And being a home care nurse, you wouldn't believe how many people are getting into their hundreds. Like, there's a lot of people getting older and older.
And they need to know about this program. So who has to enroll in Medicare? When do you enroll in Medicare? Where do you enroll in Medicare? And is there ever a situation where you're just automatically enrolled in it and you don't have to worry about it?
So everyone should enroll in it when they're 65. So if you retire before you're 65 and you're collecting your Social Security, you will automatically be sent, the information from Medicare at your 65th birthday. So, but if you're not already collecting your Social Security, it's your responsibility when you're getting to be 65 to go and enroll in it. And you actually enroll on the Social Security website. AARP has great resources for you to help with that too. There's a SHIP program that all the states have. They have different names. Like for Pennsylvania, it's PA Medi. So there's those different programs can help you figure out how to sign up for Medicare and what your options are. And what was your other question?
My question is, when do you enroll? And you enroll when you turn 65, but isn't there a period before you turn 65 and after you turn 65? What's that window of when you can enroll?
So you get 3 months before you're 65. So you can start enrolling 3 months before. You have that month of your birthday you can enroll. And then you have 3 months after. So they give you a 7-month period to do the enrollment, to collect your research, and to get, see what you want to enroll for and what works best for you.
Yeah, and as you pointed out, the only time that you don't have to do this, that it's automatic, is if you're already collecting Social Security before you turn 65, then you're automatically enrolled in the program. Is that how it works?
You're not automatically enrolled. You still have to enroll yourself, but you will get the information in the mail from
Okay.
Medicare about how to enroll and stuff like that, what you'll need.
Okay, so what if I'm 65, I'm still working, and I get medical insurance, health insurance from my employer? Do I have to apply for Medicare?
No, that's a great question. You don't have to apply for Medicare if you're still getting under your employer. There is a little bit of you want to make sure that your employer has at least 20 employees on their payroll, because then you'll still be fine to keep their insurance. But if it's a smaller company, less than 20 people, then you should and you really need to enroll for Medicare.
Even if I'm working and even if I get health insurance through the company?
You're better off trying to, yes. And it's so specific. That's why, you and I have discussed too, there's so many little gray areas of it. So if it's a company over 20 employees, you can still stay on the health coverage for your employer. But if it's a smaller company, then you need to look at your Medicare as well.
Okay, Tiffany, here we go. So Medicare has parts A, B, C, and D. Thank goodness there isn't an E, F, G, H, blah, blah, blah. So let's start with Part A. What is Part A for? What does it cover? And are there any costs associated with that?
So Part A really covers all of your hospital stays, right? There's a little bit of rehab it might do here and there, and maybe a little bit of other things, but Part A is really if you have any hospital stays. And Part A is something that, again, you've been paying into with your payroll, so that's something that you don't have a premium for that comes directly out of your paycheck.
So there's no cost involved with Part A, and that's for any type of hospitalization, correct?
Yes.
Okay. Let's go.
There's always also going to be that little spot where someone might have, depending on people's incomes, then it also gets a little gray too. But for the most part, you shouldn't have to pay anything for Part A.
That's Part A.
Correct.
Okay. Part B. We're going to go on to Part B. What's covered, and are there costs involved with Part B?
So Part B is going to cover your outpatient stuff, such as your doctor's visits, your wellness visits, a lot of your prevention. It's also going to cover some of your home care agency costs, your durable medical equipment, if it's your wheelchair, if it's a hospital bed, things like that. So this is going to have a cost to it. It's going to be, right now this year, the premium is $185 a month. So now there are talking about in 2026 that might go up to over $200 a month, but that does come out of your Social Security monthly benefits.
So that comes right out of your Social Security. You don't need to worry about writing a check for that. Now, you said it was $185 a month, but I understand, or my understanding is that if you tend to be higher income, that maybe you've got income coming in from investments or things like that, that 185 might be higher. It depends on your income. Is that correct?
Correct. That is correct. So when I was reading the other day, it was about $106,000 a year or more. They might they might up your premium, and that's something, again, case by case basis, which honestly, Medicare is a lot of case by case.
Okay, so that was Part A and Part B, which they call original Medicare.
Correct.
Now, we know there's a Part C, but we're going to skip right to Part D.
Okay.
And it'll make sense later. So what is Part D? What is covered by Part D? And are there any costs associated with that?
So Part D is going to do your prescription drugs. I don't know. I remember it, D is drugs, your prescription. I don't know if they did it that way, but I think it was genius if they did. So Part D is going to be your drug plans and your different prescriptions. So no matter what kind of Medicare you pick, you are going to need a Part D plan. So, and that's going to have a premium as well. So, like, for example, I was just asking my parents today, they pay about $40 a month for both of them. So, and that kind of depends on what plan you choose as well.
That's not something that you get through the government. Is that correct? My understanding is you get Part D through private insurance. Is that correct?
Correct. You get it through private insurance, but they have to be approved as a Medicare approved company or pharmacy.
So you just can't go and get that type of health or that insurance coverage for your drugs from anybody. They have to be Medicare approved. Okay, so we did part A, part B. We jumped to D. Now we're going to come back to part C, which is known as Medicare Advantage. What in the world is part C? Where do we get it? And what costs are involved with part C?
Yeah, so part C took me a while to wrap my head around, and I would always explain it as, I don't know if you've seen like the late nights, there's always some celebrity pushing some type of extra piece of insurance, right? I always say, Joe Namath is selling or somebody is selling another piece of the insurance. So that's your Medicare Advantage. So that's going to add different things to your plan. So straight Medicare, meaning the original or traditional that we talked about, does not cover dental, does not cover vision, does not cover hearing. Some of these Advantage plans will cover those things. So if you want traditional/original Medicare, you can't get Advantage. But Advantage is through other private insurances that are going to give you a little bit more options and cover some of the gaps that the straight Medicare does not pay.
So Medicare Advantage, or Part C, as they like to call it, and in my head, you said Part D equals drugs. In my head, I go Part C equals combo.
Right.
It's Part C is a combination of A, B, and D. So it's all of the above. It's your hospital, it's your doctor visit, and your drugs. Is that a good way to sort of explain it and to boil it down into basic terms?
Yes, I think I like that. The D part also is the same as if you have traditional Medicare or if you get the Advantage, you still have to make sure you go to a company that's approved by Medicare for the D. And it's, you still have to shop around for the D as well. But then there's different things. So for example, my uncle is planning on retiring last year, but he still hasn't retired yet. So he could do traditional Medicare, but because he has one different drug for his blood pressure that's not covered by the Part D for straight Medicare, he needs an Advantage plan specifically for that drug.
So you have to shop around and you have to ask these right questions, and you need to make sure that whatever medications that you have are covered under that particular plan offered by that particular company.
Yes.
Holy smokes.
Work. I know. And can you imagine being a little bit older and not having any friends or family to help you, and then you're on 6 different medications, right? You have to actually go through the book, the annual notice of change book that Medicare sends every September. Everyone should be getting it now, so make sure you check your mail for it. You almost have to look through and find your medication and see how much it costs, if it's changing for next year. It's a lot of work.
So when you go on Part C or Medicare Advantage and you get that through a private insurance company, is there an additional cost? Because you already said I'm paying $185 a month for Part B through Medicare, and that covers basically Part A and Part B. So now I'm getting this Part C, which is Medicare Advantage. Is there an additional cost for Part C on top of the $185 that I'm already paying for, which is probably going to go up next year?
So there's definitely going to be some type of payment that's going to vary by your state. You will be paying a little bit of something. The exact number, you're going to have to shop around. That's the best way to do it, is just shop around, see the different plans, because based on where you are, it could be more or less.
What are the limitations? So when I say that, my mother has Medicare Advantage, and she lives in the Pittsburgh area, and she has this through a particular insurance company. But if she were to travel to Utah, for instance, and she gets hurt there, will her injuries be covered with her Medicare Advantage plan if she travels outside of Pennsylvania?
That's going to vary by her plan. So there's I actually wrote a note the other day when I was just kind of reviewing things, and I put the Medicare Advantage plans might not be the best for people that you would call snowbirds, right? If they go to Florida, they might not be covered in Florida if they live up here in PA. So that's going to be another thing that varies plan by plan. With Medicare, you'd be covered wherever you go, but with the Advantage plans, those are going to change depending on your plan.
What doesn't Medicare cover?
So yeah, Medicare does not cover your dental, doesn't cover your vision. Although if you are a diabetic, Medicare will cover a yearly exam by an eye doctor that is, Medicare approved, to just check your eyes once a year if you're a diabetic. And then also it does not cover hearing. And it also doesn't cover any nursing homes. Very few of them do. Nursing homes we see more covered by our Medicaid. But the Medicare usually does not cover any type of nursing home stay.
So that's long-term care that you're talking about.
Yes,
if you need
correct.
to go into a nursing home. So if I need dental or vision or hearing, that's more insurance I have to get in a different capacity. Is that what you're telling me?
Yep, it's a whole different thing. And that's why I think a lot of people will switch to the Advantage plans, because they think, all right, I'm going to get more. I can get my eyes checked more, maybe my hearing, maybe my dental. That'll be covered since it's not covered under our traditional Medicare.
And that's why they might get the Advantage plan.
Correct.
Now, you talked about nursing home and long-term care not being covered, but I want to ask you something completely different. What about skilled nursing, which is different? Again, I had a situation. My mom just fell. She was injured and she went into skilled nursing for her care. Is that covered by Medicare?
So that's a certain number of days. Now, I guess it's going to depend on how many days she was in there. Do you remember how many days and how many days were covered? Because that's going to vary by plan.
So that all depends. So in some cases, it's covered for a certain amount of time. But again, it varies from plan to plan. But that's different. Skilled nursing, when you have an injury, is different than going into long-term care. And some of that would be covered. Okay, here's another one that I don't understand. What is Medigap coverage? What is that?
The Medigaps are in addition to your straight or traditional Medicare. You can get original Medicare, and then you can get the Medigap. You have about 6 months to enroll in a Medigap plan when you get your original traditional Medicare. If you have Medicare Advantage, you cannot get a Medigap plan. So the Medigap plan is going to vary from state to state. Now, we were just talking, you have Part A, B, C, and D. So for the Medigaps, they are plans. So they go from plan like A to N. So there's a bunch of different plans you can choose from as well. I know, it just keeps getting better and better, right?
You're giving me a headache. I thought I got it down, and now you've really threw a monkey wrench in. Holy smokes.
I know. So that's the thing. You have the different parts. We have the A, B, C, and D parts. But now with your Medigap, you have the different plans. So you need to make sure you do your research on the different plans. So for instance, my family, my aunt and uncle have the Medigap plan G, like George. So they pay a little bit more up front, but it allows them to have, more wellness visits. It goes to different gyms and stuff like that. But then as they get more care and they need more care or something down the road, they're not going to have to pay as much for it.
And is this, again, something that I would get through private insurance? This is not offered through the government. Is that correct?
Correct. Yes.
And do you shop around for that as well to find the best price and the best plan for you?
So yes, it varies state to state. So you're going to want to make sure you do shop around and you see what your options are. Because like I said, there are plans from A to N. And my parents have a supplemental Medigap that's from the state through the school that they worked for. And, my aunt and uncle bought a plan G, which they just bought themselves through another private, insurance. So yes, you just have to, it's all going to vary.
We have some important dates coming up. October 15th through December 7th, I believe, is considered to be open enrollment. What is that for?
So the open enrollment is so one of the things that's very important, no matter if you're happy with your Medicare plan or not, whatever plan you have, during open enrollment and even a little bit before, you should start taking a look at the plan that you have, even if you're happy, and also kind of shopping around, because one of the things that I recently learned that a lot of these premiums and a lot of the drug prices, everything can change year to year, and they can even change it mid-year. So if I'm paying, I'm going to make something up, $2 for my blood pressure medicine now, next year it might go up to $7 a month. And if I'm not paying attention, all of a sudden now I have a price increase, but I didn't know. So that open enrollment period, it's very important, like I said, to look at the annual notice of change book that Medicare sends everyone in September. You can go through and look at all the plans that are there, see what the changes are. Like we talked about, there's going to be an increase in the premium for our Part B next year. So, you're going to want to make sure you take a look, and if you need to adjust, that's when you do it during open enrollment.
So hypothetically, if I turned 65 in February and I picked a plan and I'm not really happy about it or happy with that plan, that's when during open enrollment, I can pick something else.
Correct.
Okay. So then January 1st through March 31st is Medicare Advantage open enrollment. How is that different, that period versus regular open enrollment? What's the difference there?
So that's just your, I think they just kind of separate it. So it's just the traditional Medicare has some time to take a look, and then your Advantage plans, if you want to go back and forth. It is, and I'm going to have to look at my note for this because this one was very interesting to me. If you start Medicare Advantage, you can switch to Medigap in the future. However, this is one of those instances we kind of talked a little bit, you and I, before about pre-existing conditions. If you want to switch, sometimes then the companies might look and say, all right, do you have any pre-existing conditions? And then they'll up your premium cost. So, if you decide to change, just know sometimes the insurance companies might take a look and say, are they a smoker, a diabetic, hypertension, things like that. And then they could adjust, the price that you're paying based on some pre-existing conditions.
We also had some questions come in, and I want to share some of these questions with you. This one says, I'm retired and I will be eligible for Medicare next year. My husband is still working and I'm on his employer's health plan. Do I still need to apply for Medicare?
So as long as he is still employed, as long as he's still working and you can still get the benefits through the employer, and like we kind of mentioned before, there's 20 or more employees, everything is fine. You'll be good until he retires, but then you both are going to have to enroll for Medicare after that.
Okay, here's another question. What do you need to do if you continue to work and you stay on your employer's health care? I currently have an HSA account and I read that you should not go on a plan A or a plan B due to that type of plan, meaning the HSA.
So actually that was a really good one, and I had to look that one up, and I typed that one into the AARP.org question. And if you do go on the plan, if you do go on to Medicare, you are not able then to enroll, to add more money to your HSA. You can still take your HSA out, you just can't contribute anymore.
Okay.
So it's really important, if you still want to contribute to your HSA, stay with your employer's benefits and insurance for now. And then when you're ready to retire and go to Medicare, you still have access to all that HSA. You just can't contribute any more to it.
Okay. Here's another question. I'm a retired state worker and I currently still have health coverage through the government. Do I still need to apply for Medicare at 65?
So this is one where I think, it fits my parents, and my parents, if you can actually take both. So my parents still have their state insurance, state benefits, and they also have Medicare. So you definitely can, and you should.
This question, what is the donut hole and was it recently eliminated? What's the donut hole?
So the donut hole is something that has to do with your Part D, like your drugs. So actually that was I want to say they say they closed the donut hole in January of this year. They had new bill that was passed. It was the Inflation Reduction Act. And what happened is it capped your max out of pocket for all of your prescription drugs for $2,000 for the year. So if I have one medication or if I have, 17 medications for the year, I'm never going to pay more than $2,000, which is actually great. Because there's a lot of people that, medications are very, very expensive. So
Yeah,
now
they
they
are.
pretty much capped your out-of-pocket expense. So you still have a $590 deductible that you have to meet. But once you meet that deductible, then you're not spending any more than $2,000 for the full year.
Okay. This question, if I don't buy a Part D plan, are any of my drugs covered by other parts?
No.
No. So you have to buy Part D to get any type of drug coverage.
Otherwise, you're just going to be paying full price for your prescriptions when you go pick them up.
Okay. Hit this question. If I miss the deadline to apply for Medicare and I apply late, I understand I might be charged a late enrollment fee. Is that true? How much is the fee and why are they charging this late enrollment fee?
Why they're charging it's a great question. That I don't know. There is a fee, so there is going to be a fee for it. It's a percentage of the cost. So it could be 1%, 3%. I forget what the exact percentages are. But yes, the longer you wait to sign up, they do penalize you. And, they'll take that percentage then and they'll add that on to your premium.
And it doesn't go away. I guess it's there for the duration while you're on. So it's really in your best interest to apply on time.
Yes. Mm-hmm.
Okay.
Yep.
Is there a one size fits all plan or can we pick plans?
So you definitely want to pick plans. There's not a one size fit all. Even for just you and I today, you might need something that I don't need. So it's definitely, you need to shop around.
All right. You touched on this briefly, but let's go a little bit more in depth. This question, what if I have a pre-existing condition?
Okay, yes. So if you sign up right away when you are eligible for, right, the insurance companies aren't really going to take a look. Everyone's eligible to sign up no matter what your pre-existing condition. If you wait till after your enrollment period and then you try and sign up for something else, you have the risk of the insurance companies then looking at your pre-existing conditions and charging you more of a premium because of those conditions.
So again, it's in your best interest to sign up on time when you're supposed to. Okay.
Correct.
And this final question, do all doctors accept Medicare or will I need to change my physicians? Ouch.
I know, that's a good one too. So if you're doing traditional or original, pretty much all the doctors accept Medicare. There's very few, I would think, that don't. If you have a Medicare Advantage plan, if that's what you need to go for, then yes, you may risk changing your physicians because you're going to need to find the ones that are in that specific network for that specific plan.
Tiffany, we went over so much stuff here. It makes your head spin. If you had to give somebody advice on Medicare and the plans to pick, what would you tell them?
So first of all, I would say, make sure you shop around. The biggest thing is to start and see what you can afford. Go by that, what your needs are right now. If you can foresee different needs in the future, I know that's easier said than done. And then also look for the resources you have. All states have SHIP programs. Those are state health insurance assistant programs. For Pennsylvania, ours is PA Medi. So it's PA, Medicare, Education, and Decision Insight. It's a great program. You get free counseling from a certified counselor. It's all confidential. They will walk you through the different programs. They will tell you the options that you have. They can help you enroll. It's actually on pa.gov and it's under the Department of Aging. So you can just Google that and take a look. And actually on the back of the Medicare book has 800 number for all the different states. So you can see what state you're in and it'll help you, refer you to the SHIP program. So really, it's just asking a lot of questions and trying to find the right resources.
And I understand that AARP Pennsylvania also has a great resource where you can plug in questions. And what's the website for that?
So yes, it's great. It's aarp.org/Medicare. And it'll say Ask Medicare. You type that You just type your question right in there and you'll get an answer from one of the AARP Medicare experts.
Thank you so much for coming on this podcast. I think we're both going, whew. I mean, this is a tough one, but it's like we all have to go through this. And I just don't understand why it has to be so complicated. Why? Why?
I agree. I have no idea. I told you, I made 4 phone calls and I had 5 pages of notes, and it still can be very confusing.
It is very confusing, but I do think that you helped boil it down and help us understand what the different parts are. And again, great advice coming from you. So thank you so much for coming on the podcast, Tiffany.
Thank you very much. I had a great time.
Thank you. And thank you for tuning in. Again, this is such a difficult a subject to understand. It's confusing, it's complex, but we all have to go through it because most of us are going to have to go on Medicare, at least when we turn 65 or even later if you continue to work. So again, we hope that we provided some great information for you so that you can make some smart decisions when it's time for you to sign up for Medicare. Thanks for tuning in. Thanks for watching. And we will be back soon with a new podcast episode.